Welcome to another video, dear friend. I hope you will be fine. In this video, you will come to know the bad effects of alcohol on the heart. Doctors have long suspected a link between alcohol and heart issues. According to the Centers for Disease Control and Prevention, an estimated 12.1 million people in the United States are expected to have atrial fibrillation in future by 2030. Let's discuss alcohol's effect on the heart in detail. Number 1. Risk of atrial fibrillation. A new study has found that consuming alcohol, even as little as 1 can of beer or 1 glass of wine, can quickly increase the risk of a common type of cardiac issues, that is atrial fibrillation, in people who have a history of the condition. According to the researchers, 100 people were recruited with a history of atrial fibrillation and tracked them intensely for 4 weeks, monitoring their alcohol intake and their cardiac rhythms in real time. Resultantly, the scientists found that drinking alcohol heightened the odds that a person would have an episode of atrial fibrillation or an abnormal heart rhythm within the next few hours. The more they drink, the greater their likelihood of having atrial fibrillation. Here is also a reference of the new study that was published on August 30 in the Annals of Internal Medicine, and the conclusions along with the data from previous studies suggest that people with a history of atrial fibrillation could reduce their chances by cutting back on alcohol or avoiding it altogether. Guys, moderate drinking is widely considered beneficial for heart health. But the new research suggests that at least in some people, it could potentially disrupt how the heart functions. This demonstrates that whenever we consume alcohol, it is presumably having a nearly immediate effect on the electrical workings of our hearts, said by Dr. Gregory Marcus, an author of the study and a professor of medicine in the Division of Cardiology at the University of California, San Francisco. Number 2. How atrial fibrillation occurs. Guys, atrial fibrillation is also known as AFib. It is the heart rhythm abnormality that has been affecting almost 3 million adults in the United States. It occurs when the upper chambers of the heart, the atria, start beating irregularly, which can disrupt blood flow to the lower chambers of the heart, called the ventricles. Over time, it can lead to complications like heart failure and strokes. AFib can be persistent or it can occur sporadically, with symptoms such as palpitations, shortness of breath, and fatigue that last for a few minutes or hours at a time. When the episodes occur occasionally, the condition is known as paroxysmal atrial fibrillation. Number 3. Heavy drinking and age. Guys, people have greater chances of developing atrial fibrillation as they got older. It is also more likely to occur in people who have risk factors such as high blood pressure and obesity. About 4 decades ago, doctors began documenting cases of people experiencing atrial fibrillation after bouts of heavy drinking on weekends and holidays, a phenomenon that came to be known as holiday heart syndrome. Since then, a number of large observational studies have found that people who regularly consume alcohol, even as little as 1 drink a day, have an increased likelihood of going on to develop atrial fibrillation compared with people who abstain. Number 4. Dr. Marcus study. Guys, Dr. Marcus and his colleagues recruited 100 people with a history of paroxysmal atrial fibrillation, and after 4 weeks of tracking, the researchers found that at least 56 participants had experienced an episode of atrial fibrillation. The data indicated that alcohol was often a trigger for atrial fibrillation. Having 1 drink doubled a person's odds of having an episode of atrial fibrillation over the next 4 hours, while having 2 or more drinks tripled the odds of an event. The higher a person's blood alcohol concentration, the greater their likelihood of having atrial fibrillation. Number 5. Dr. M.R. Piano's study. Dr. Piano, a professor and associate dean for research at the Vanderbilt University School of Nursing, said that atrial fibrillation is an intense heart issue that can have life-changing effects, like having a stroke, and so understanding what might be an acute trigger is really important to communicate to our patients. According to the researcher's study, the trigger is alcohol. She said that healthcare providers should have conversations with their patients especially those who have atrial fibrillation, about how much alcohol they consume and whether it would be prudent for them or cut back or avoid it. This is it, guys. I hope this video will be informative for you. So avoid alcohol for the better health of your heart. Thanks for watching.